Hello, my name is Sarah Blythe, and today I'm going to speak to you about the clinical and cultural applications of a cycle charting practice, sometimes known as fertility awareness, but we will break down various terminology a little bit later. A little about myself to introduce you. I'm a former midwife, not practicing currently, and for many, many years now, since 2004, I have been offering women's body literacy courses and most currently offer a 2-year teacher training program to certify educators. And I also work in various institutions and programs teaching healthcare providers. And I have a private practice where I work with individuals and groups on various women's health and body literacy topics. So without further ado, I'm going to offer a PowerPoint presentation, and so you can follow along with the images that I will share. And I'll check in a little later at the end and say goodbye. Here we go. Right. So the outline that represents what I'll cover today, so you have a sense of where we're going. I'm going to cover some terms and definitions and modern understandings of these literacy practices, do a little bit of myth busting and discuss some of the common beliefs that are incorrect, and go over the history of these practices and the current climate here in the United States and somewhat in other countries as well. Then I will do an overview of the most popular ways that these practices are utilized, which are for contraception, for conception, for general cycle health, or the term cycle health as the fifth vital sign, for self-awareness and empowerment. And I will touch a little bit, for anyone who is a healthcare practitioner, I will touch a little bit on using the practice from that standpoint with your clientele. We'll touch on apps, the use of apps for this practice and period trackers, and then we'll look at some sample charts to make it a little more real. So, in general, the word fertility awareness may mean many things to different people. I currently prefer the word body literacy, a body literacy practice or lifestyle being an overarching term that includes in that the charting, the cycle charting practice. So I will use some of these terms interchangeably. To me, this is a lifestyle choice. It is a way of living with your body, in your body, that includes a set of listening skills that we can learn if we don't already feel we have innately. And so living in this way with utilizing these listening skills, it becomes a lifestyle of self-awareness. And the practice itself, I would consider a self-care practice or a self-awareness practice, where we're tracking certain biomarkers and signs and signals that our bodies give us to become more literate, more body literate, and inevitably more earth literate. And what I mean by that is that I believe that knowing our bodies and knowing this planet and the elements that we live within and that sustain us is incredibly interlinked. And so I will bring in some of that education as I go through this course and in other courses that I offer. My goal in offering this information to the world is to encourage a sense of empowerment, a sense of sovereignty where we, as those born into female anatomy bodies, that we believe that we are the experts of our own bodies, and thus we have allies in our healthcare, but they ask us, and we are the one who are listening to our own bodies and cycles, and are able to inform our healthcare practitioners in a way that we are doing co-care with them. And inevitably, I also believe that this creates a sense of embodiment and empowerment that has huge cultural effects. And I believe that we're living at a time in which it's important that the voice of the nature of the feminine, the nature of the female anatomy people on the planet, that has a lot to offer to our culture and the way we design our culture. We've been living in a patriarchally designed time, and I think this is shifting, and for good reason, if we want to sustain life on Earth. So I also believe deeply that in becoming sovereign women, experts of our bodies, in touch and empowered and embodied, that we have the potential to become guides for our own culture, for the emerging culture, the evolving culture. So that is my deepest wish, that that transformation and evolution is happening and will continue to happen through the choices we make. This education, to me, is part of a model of care that honors a continually changing body, spirit, and emotional being, and respects these transitions that we go through in our lives, and respects that each individual will be met by this information and this practice in different ways throughout the different times of their lives. So it's similar to many types of holistic care models, in which we are treating and working with an individual rather than an idea of how a cycle looks or a healthy body functions. We're meeting one person in the position that they are in to offer them support for their own goals. Ultimately, what's involved in including this practice into our lives is a lot about education, that we receive a foundational package of or skill set around anatomy and physiology and the real basics of how our bodies work. And we're able to apply that and connect that with what our bodies are telling us. So the education, the understanding of our physiology, combined with our listening and tracking of our biomarkers, of the signs that our body's giving us. And then we take that and we apply it to meet the goals that we have in the moment. The education piece is really essential in that anyone can learn how to track their cycles, to take their temperature, to look at their cervical fluid and write it down. But there's a whole nother level of deepening and empowerment and understanding that happens when you also have the educational piece of the picture. So that is vital to the way that I offer the material. So this list is what the goals might be that you want to utilize this material for, this practice for. And I think at the bottom, for anyone that I'm teaching, what I'm offering is a self-awareness practice. And that's my deepest desire, that's what everyone gets out of it. And then from there, where you want to take that is up to you and your situation. So contraception, pregnancy achievement or conceiving, gauging your health or monitoring your health, and if you're a healthcare practitioner, medical assessment. So this is an image that I use to represent what we commonly learn when we're learning about the physiology, anatomy and physiology of the female cycle. And this goes through the hormones that are active in, these are the pituitary hormones, and these are the ovarian hormones here. What's happening in our ovaries with the process of follicular development and release of the egg, and what's happening in our uterine lining during these different phases. And what I'm proposing, and what I think is ingrained in the heart of body literacy education, is a new model that looks more like this. So we still have the uterine lining, the ovulatory experience in the ovaries. We still have the hormones. I put both pituitary and ovarian hormones together. But we also include these three things right here. And these are what we receive by these listening skills, by this way of being with our body, which is we record our basal body temperature, we record the secretions, the vaginal secretions that we find, and we record our cervix position. And when you put these all together, there's a deep understanding of how the cycle of the female body and the female reproductive system functions from the inside and the outside. So I'm pausing to show you this funny meme about some of the common beliefs that our current culture associates with these practices. So natural family planning is a term that came out of the Christian practice that is very similar to what I teach, what is being taught. And so it works for this situation. And this just shows some of the ways that it's looked at through different lenses. And I think it's important to name these stories and name the way that our culture holds these things, because it's time for this to change. It's time for there to be a resurgence of the validity and recognition of this as a scientifically proven, evidence-based practice, as well as something that has a huge potential to change the way we live in our bodies and the way that our culture functions. So now I'm going to go into a little bit of history, and don't need to get too taken by all the many words on this slide. I'm going to point out a few things, though, that I think are really important. It was in the beginning of the 1900s that science, quote, discovered, unquote, ovulation. And throughout the next several decades, there were other discoveries that were made by doctors and scientists that led to these early forms of the practice, the rhythm method and the Billings method being two really popular ones. And then, without names, the World Health Organization the World Health Organization created their own rules or their own method also. So this is all before the 1970s. And there's quite a shift here come the 1970s. Obviously, during that time, the 60s into the 70s, there was here in the United States, as well as elsewhere, especially in Europe, there was a lot of big shifts happening culturally that have to do with sexuality, reproduction, reproductive rights. This is the time in which the contraceptive pill was introduced and the time when abortion was introduced, which in my assessment of history, of women's history, this was a crucial time of shift and of liberation for women here in the United States. And I believe that we're in another one of those really critical junctures right now, in that with the onset of the use of the pill and abortion, women got to recreate their relationship to their sexuality and their reproductive capacity. It was huge, huge culturally. And I feel that right now we are going through a time where we are not satisfied any longer with those tools, which aren't necessarily health supportive, the contraceptive pill not being health supportive or all that empowering on other levels. We'll talk about that later. And perhaps we aren't wanting to rely on abortion or don't believe in it from a spiritual perspective, or don't believe in it for ourselves individually from a spiritual perspective, whatever that looks like, whatever the relationship is with abortion, which is very individual. I think that we are moving to the next level of options, which to me is what I'm speaking about, is a second sexual and reproductive revolution and liberation, time of liberation. I'm going to speak more about the sexuality aspect shortly, but I wanted to share that. So from here, what happened was that there's a lot more research that was done, and a secular fertility awareness movement. So it came out of the church. It was mostly taught and practiced by those within the Catholic Church prior to that, and it became a more secular method. And in the 1990s, the book Taking Charge of Your Fertility was published, which was monumental for the dissemination of the information at a more public level. So finally, I want to mention, well, two things left actually. The Frank Herman study, the Petra Frank Herman study, which was done, there was one in 2007 and one in 2011. I will refer to that later, but it was a study done in Germany that found this practice to be highly effective for contraceptive purposes. In fact, it found it to be as effective as the pill. Also, Georgetown University created a program called the IRH, Institute for Reproductive Health, yes. And they have done work internationally, both research and teaching of various practices, which have had a large impact also. And then the last thing that's on my timeline here is the apps and internet presence. And as you may have noticed, if you pay attention to these things on the news, there's been a huge amount of discussion about the effectiveness of apps and FDA approval, for instance, of apps here in the States and in Europe. And I have mixed feelings about this, which I will talk about at a later point in the class. It has brought this practice more to the public eye, which is quite a gift, but not in the way that I think is most beneficial. So, and it's a significant time right now that that's happening. So here's some terms I want to just roll through so you're all familiar with them when I use them. I already mentioned the word body literacy, which I really am preferring these days as an overarching term. But these are more specific. NFP, or natural family planning, as I mentioned, was inspired by the use of this practice in the Catholic Church, but can be used interchangeably as it is the same or very similar practice. Fertility awareness being, to me, the lifestyle choice or the greater practice or set of skills and education, whereas fertility awareness method is the actual day-to-day practice that you can learn in order to chart and achieve the goals you want. And fertility awareness-based methods, that is a somewhat new term that was coined by Georgetown University in the IRH, and it is meant to be an overarching umbrella term that holds within it all of the different practices, which we'll look at momentarily, all the different practices that I would consider cycle tracking practices. So the fertility awareness method being something quite specific to those of us teaching secularly or outside of the church, mostly in the United States and yet also in some other regions, and those who use the practice as taught by Toni Leschler in Taking Charge of Your Fertility. Whereas fertility awareness-based methods might include also the religious practices, also the practices that Georgetown offers that are simplified versions. So I'll share about those shortly. And then symptothermal method is another term you might hear, which describes the two aspects of the fertility awareness practice. Sympto, or signs that your body is telling you, and thermal, your basal body temperature. So cervical fluid and basal body temperature basically is what STM represents. Okay, so to break that down a little bit more, within the fertility awareness-based methods, we have observation-based, calculation-based, and a combination. So I feel that this education is really important because of the bad reputation that many practices have and the misassociation between practices. And so to me, it's essential that we understand the differences and what the differences create when we are using those variant practices. So calculation-based, you probably have heard of the rhythm method. The rhythm method on that timeline was discovered or created a long time ago, like 100 years ago. So you might guess that it is a bit outdated and has evolved quite a bit since that time. If you imagine that, you're right, it's true. One evolution of that, so basically the rhythm method is a belief that if your cycle is within a normal length, then there's a range in the middle of that cycle in which you would be fertile because we ovulate somewhere in the middle of our cycle. So for instance, in a 28-day cycle, you might assume that from days 9 until day 17, you're fertile, and any days before and after that, you're not. It's based on a calculation. It is not based on a woman's individual cycle and thus has great drawbacks and is quite a bit less effective. So the standard days method is a term used by Georgetown University, and it is an up-leveled form of the rhythm method. It's still calculation-based, it's still very simple and based on your history, not on an observation. So it has limitations and a lower effectiveness rating, but has a few updates from the rhythm method. Cycle beads are basically the rhythm method. It's a set of beads, like on a necklace, and you move a little rubber band over the bead for each day of your cycle, and they're colored differently to tell you when you're fertile and not. Now these methods, the cycle beads and the standard days methods, are taught through the IRH, through Georgetown, in situations where the population might have a lower literacy rate or less resource to be better educated. It may serve a woman or a community better than nothing. In fact, I would say it will serve them more than not having any similar practice. So most apps and trackers are also calculation-based, and this is really, really important. I really want to get this across, that almost every app that's out there predicts. It predicts when you're going to be fertile and when you're not, and it is based on your history, and perhaps it's based on the history of your own temperatures rather than a generic set of temperatures. That would make it one step above the rhythm method in that it's based on algorithms. Most of these apps are based on algorithms, so that means they're adding up your data and other people's data. And some it's other people's, some it's just yours. And they're making assumptions and guessing when you might be fertile in future cycles. Unfortunately, a good share of the population does not have regular cycles that are the exact same one cycle to the next. So this is why most apps are not going to be as effective. they also lack what to me is the key aspect of the practice on a larger level of that empowerment and self-awareness. And I want to add that there are apps in which you can just set them to be used for data entry. So basically, you have to learn how to do the practice yourself, as someone like myself would teach, but you can enter that information onto an app, and so you have a place where it's held and carried for you that's digital. And I would say that is right use of an app, rather than letting it predict, which overrides your own sense of learning your own body. So I also have astrological birth control, which is based on your astrology and tells you when you will be fertile depending on your birth astrology. Obviously, that's a calculation, not an observation. And the lactation amenorrhea method, which is what is utilized postpartum for women who are exclusively breastfeeding postpartum. And it has pretty good ratings statistically. It only applies for the first 6 months of breastfeeding, assuming you're exclusively breastfeeding. And there's a lot more to learn about how to use that method with a cycle tracking observation-based method to be more effective postpartum. So moving over to observation-based, this means that you're making a daily decision about whether you're fertile or not. So obviously it's going to have a different set of statistics of how effective it is for contraception, as well as aiming your conception, or choosing when to make love in order to conceive. If you're looking and listening to your body and following that, you have there's a whole other angle on that decision. So it's a daily decision of if you're fertile or not. Symptothermal is the big circle here. That is what I teach, what you learn from the books, the book that I've mentioned. There's also Book Garden of Fertility is another great textbook. So it includes cervical fluid checks, basal body temperature, and cervix checks. Cervix checks being optional. The study in Germany that I mentioned and we'll revisit was the symptothermal method. But they included a calculation. So it has all the benefits of an observation-based method, but it also includes one calculation to make it a little more strict. So you see over here that I have that symptothermal is practiced in Europe. You can learn it with or without that rule. May or may not be more effective. We don't have studies on just this. We only have this good study. We do have studies, however, on cervical fluid only, that I'll share later. So cervical fluid only or temperature only are variations of observation-based practices, and I think it's obvious what they involve. There's a lot of studies on cervical fluid only practices because the Billings method is a very popular and long-standing practice. So temperature only is a little less common. It doesn't give you as many days of what we call safe for unprotected if you're using it for contraception, but it's very effective. And then the 2D method is an IRH method also taught through that program. It's a simplified version of the cervical fluid only practice that is reasonably effective, but perhaps appropriate for certain populations of people. And the only other thing I didn't mention was this one right here, which is a mixture. This is out of Marquette University. They have a program, also it's a Catholic university, they have a program that, and a practice that involves doing cervical fluid checks, but entering that data into a device that also collects algorithms from your temperatures. Okay, that was a lot of information. I'm gonna keep going. We're gonna shift gears to the uses of the practice. So that was kind of the backdrop of what's out there, what's available, how it's being utilized. And now I'll move to some of the uses that I spoke to at the beginning. The first being contraception. So we'll walk through a little bit about using this practice for contraception. I'll give you a moment to read some of these myths. Actually, why don't I just read them with you? Every one of these is a myth except one. So every time you have sex, you're at risk of pregnancy? Absolutely not. And yet that is a commonly held story that perhaps is taught to high school students to scare them away from intimacy. So that can be clarified with this knowledge. Myth number 2, FAM's only effective if you have regular cycles. Absolutely not. In fact, you know whether your cycles are regular or irregular. You learn a great deal about your cycles when you do this practice. And it's a daily observation, so it doesn't matter what your cycle looks like. You're making a decision each day. The third myth, or fact 3, using a phone app versus paper charting are both effective ways. I just explained how that's not true because most phone apps are not effective for contraception. Myth 4, fertility awareness and the rhythm method are the same thing. I also just busted that myth in the last slide. Myth or fact 5, OPKs, which are ovulation predictor kits. That's that when you pee on the strip to tell you if you have an LH surge, are an easier way to conceive than FAM charting. Now that one's up for discussion. Using them is quite easy. So easy, if the word is easy, perhaps. But if the word is effective or thorough or empowering, then no. Charting your cycle gives you a huge amount of information in the process of conceiving. OPKs give you one thing, which is when your LH surge happens, which, yes, often happens right before ovulation, but it can also be incorrect and happen at another time and not be so helpful. Myth 6, you cannot get pregnant during your period. Not true, and that's also commonly held story. The truth is you can start your fertile wave, your fertile time, while you're still bleeding. It's not super common, but it is possible, and that is taught when you learn the method. How you work with that is taught to those who learn the practice. Myth number 7, you can ovulate more than once in a cycle. This is a trick question. So you can release more than one egg, but it's in one act of ovulation. So what the studies show unanimously is that if you release 2 eggs or ovulate twice in one cycle, it's within 24 hours of each other. So what it means is you can't ovulate and then a week later ovulate again. Not possible. But you could a day later ovulate again, and that would be the max between the one and the first and the second egg. And fact number 8, fertility awareness is an effective form of birth control. Absolutely. So this is my list of benefits of why we might want to learn how to do this practice and use it for contraception. We deserve this information. We deserve an option. That is like absolutely across the board, for sure, most important to me. We should know that we have this option, whether we choose to use it for contraception or not. This is something that is a birthright of those who are in a female body. Completely safe with no side effects. It's effective, inexpensive. All you need to do is buy a thermometer and print out some charts and potentially take a class, or at least read a book and get a consult. So there's a little money up front, but not on an ongoing basis. It's empowering, it's natural, ecological, and aligns with spiritual beliefs. So this slide, I'm going to just see what, yes. So this slide here is to familiarize you with something, with the basics of one cycle in a format that or an image that I use when I'm teaching. which is starting the cycle here day 1 and going around. This is one full cycle. So it's to point out to you the phases of the cycle. First being menstruation. Second being what I call the early infertile days, where there's not a lot going on hormonally and there's no signs of fertility. The fluid we see then is a baseline fluid, and that's part of the practice, is learning to discover your baseline. This is mostly an infertile time, but there are exceptions to that, which we would discuss if you learned the practice itself. Beginning here, this is the point of change. It's when we start to see signs of fertility, namely we start to see cervical fluid. And so this part of the cycle here is our fertile wave. This is from the beginning of seeing cervical fluid through to a more expressive cervical fluid presenting, and then what I call the post-peak count, which are the days after your cervical fluid dries up, in which you're waiting to confirm ovulation. And then once you've confirmed ovulation, you move into this phase, which is the most infertile phase of your cycle, from post-peak day 4, the night of post-peak day 4, until your next period begins. That is, there's not much going on with, well, there's things going on hormonally, but it is an absolutely non-fertile time right here. So, so that gives you an overview, and I say that as I share this as a precursor to this next slide, which is an introduction to you of what I consider a full spectrum contraceptive care. So this idea, this concept, is that there is a spectrum of choices and options we have to utilize if we don't want to use a more modern method like hormones. If we want to use, but we want to be thoroughly covered. So this makes room for day-to-day choices, includes as a basis is the practice, is the cycle tracking practice, where we know when we're fertile or not, but it also includes ideas for backup during our fertile time and for backup if we make a mistake. So here's how it goes. During this first phase that I mentioned to you all, menstruation and then the early infertile days, many people, many women will not need any contraception. That's this symbol, the heart. This you will only know once you've started charting and once you've learned how to do the practice itself. But for many people, that there's no contraception needed during these days. And for some, there's contraception needed in a limited way, like on certain days. So this is one possibility. And then if you're someone who has, let's say, has a long period and needs to use some form of contraception in the days before you can check for cervical fluid, I'm giving you a little hint to how the rules work here. But basically, the point I'm getting at is there might be days in which you want to use or need to use contraception. Because this is not a high-risk time, a condom or withdrawal are really great options for combining with your own awareness to use during those times. Once a point of change happens and you're moving into your fertile wave, or you are in your fertile wave, pardon me, and in your post-peak count, if you don't want to conceive, we're talking about contraception here, then you'll need another form of contraception. So another form of birth control. So first and foremost, you can abstain. You cannot be intimate with a person of the opposite sex that has the potential to get you pregnant. You can utilize creative lovemaking. So all the other ways that you can make love and be intimate without having penis and vagina intercourse are all great during that time. Or you can utilize one of the methods mentioned before, a condom or withdrawal. And those are, they come with their own set of risks. If you know you're in your fertile time and you're using another method, you're relying on the statistics of that method. And nothing's perfect. And that's really important to understand, that there's an inevitable risk when you have intercourse during your fertile time. And that's the cool part about this practice, is that you have that knowledge and that choice at your hands. So, at your fingertips, I guess is the phrase. So, you can use any of these. Of course, these are the most effective. These have their own risks, right? And then what I also include in here are 2 other forms of backup. So let's say you are in this time and your condom breaks, your withdrawal practice is faulty, or you just take a risk and you wish you hadn't. This is the time in which the morning after pill is effective. And knowing where you are in your cycle will make the pill more effective because you're timing it accurately. So this is a combination of using the morning after pill with the fertility awareness practice. Now, I don't recommend people use hormones because it can wreak havoc on your endocrine system. And yet I do believe it's something we should have access to and the choice to use in a situation where it's necessary or helpful. So this is ovulation here, and this post-peak take count marks another backup method that runs all throughout this time, and that is this symbol here is for Queen Anne's lace, which is my preferred herbal contraceptive method. And this also requires an understanding of timing and where you are in your cycle. So, because it prevents implantation. Implantation happens over here, mid-luteal phase. So this is another form of backup if you have had one of your previously used methods fail, or you've taken a risk, or whatever it is. Utilizing Queen Anne's lace on the right timing and with the knowledge of how to use it can be a great backup for this practice. During the phase from here, the post-wave infertile days, from here, from the post-peak count of 4 until the next menses, this phase here, you don't need contraception. That's why there's a heart here. No contraception is needed for anyone during that time. But I do also include these backup methods. If you discover, wonder if you're pregnant, or know that you're pregnant from a test, you can get an IUD placed during this time, and it will cause basically a miscarriage of the fetus. And you can use a technique called menstrual extraction, which I do not teach, but I can give resources for you to have more information on that. So that is my full spectrum contraceptive care plan that I like to propose. Not everybody will have the resources to do all of this, but perhaps you want to create something like this, a plan for you that works in your life. Okay. Pause, deep breath. So I'm going to move on. This is a slide that basically just adds up some facts that show why this practice works for contraception. So here's the facts. When estrogen is dominant, you have cervical fluid. When progesterone is dominant, your temperature, your basal body temperature, is a half to a whole degree higher than when it's not. So when you're fertile, your estrogen is dominant and you see cervical fluid. After you've ovulated, your progesterone is dominant and you see a temp rise. Sperm lives for 1 to 4 hours when there's no cervical fluid present. So during a time at which there's no cervical fluid, that sperm does not live long. But, very important fact, if you have cervical fluid present, the sperm that comes in contact with it can live for up to 5 days, because cervical fluid is basically sperm food. It is made up of all the ingredients that sperm need to stay alive. When an egg is released, it only lives for 12 to 24 hours. So that period of time when you have an egg that is actually available to be fertilized is very short. It's really about these 5 days or so where the sperm can stay alive waiting for that 12 to 24-hour period that is the high risk time. And the thing to understand about where the risk lies and why cervical fluid presence makes such a difference in this practice. Women make cervical fluid, that shouldn't say fertile. I mean, it is fertile, but just cervical fluid. Women make cervical fluid on average 1 to 6 days per cycle. So that is the actual time in which you can get pregnant by having unprotected intercourse. Once ovulation occurs, that high progesterone level that happens inhibits another ovulation from occurring. So, with all that in mind, we can see why this practice works, which is what this slide says. So I'm going to add a few slides that give us a little more scientific backup. This is a study shared by FACTS. The organization FACTS, F-A-C-T-S, is a program run by a medical doctor and her staff with the goal of teaching these principles and these practices to medical school students. It's a wonderful program. There's a great website. I would encourage you to check it out. And this study is showing when, on what days relative to when we ovulate, on what days are these conceptions happening? If people are conceiving in a cycle, when relative to ovulation is it working that they're getting pregnant? And what this shows is here's 6 days before the day of ovulation. Here's 1 day after the day of ovulation. 0, 0. Everything this way, 0. Everything this way, 0. So this is the range right here when conceptions happen, are from 5 days before you ovulate until the day that you ovulate. That should make sense given what I've just shared. But this study, this is just one study. You can go to the FACTS site to get resources on this study. It'd be great if we had a lot more of these studies, but I'm pretty sure that they would be pretty unanimous in their understanding. This is fairly common knowledge in science, that those are the days in which conceptions happen. What they don't show here, which I'll show in the next slide, is what is it that makes these days so fertile? Cervical fluid. That's why the conceptions can happen. So in another study, you might see one that happens here because somehow they had cervical fluid that was present 6 days prior and sperm that was magically able to stay alive for 6 days, which is the more unusual thing. Cervical fluid is, that could happen, but sperm that stays alive, very, very, very rare. Mostly studies have shown that sperms can stay alive for 5 days max. There have been a few exceptions, but to have both the cervical fluid present and the sperm that stays alive that long is unusual. And after the egg has come and gone, 12 to 24 hours from this, there's no way to get pregnant from that point on. The exception would be if one were to ovulate 2 eggs, which I mentioned before, then one of them is ovulated and 12 to 24 hours later, another one, and that one has a lifespan of 12 to 24 hours. So that would put us at another day here. So this will all help to understand the next slide, which is coming from a different perspective. So it's not really comparable to that slide, but also really vital information. So this doesn't measure day of ovulation, it measures peak day. Or not measure, so this is representing your peak day. So basically this chart is showing when they did ultrasounds to see when ovulation actually occurred. So in this study, they already know this is the day ovulation occurred. They did ultrasounds and they found that. Whereas in this study, they wanted to see, there's 2 different studies that I'm referring to, one that was published by the Justice Foundation and one published by Billings. I think this actually is a Creighton method study, not Justice. So what they wanted to know was, okay, we're teaching people to identify their peak day, which is the day in our understanding of our own cycles, it's the day we are guessing is ovulation. So it's the last day that we have the super fertile fluid. So we're guessing by saying, this is my peak day. We're guessing, I just ovulated. How accurate are we? Is that when we're actually ovulating? What these two studies combined showed that within a day, before or after, so within a day of when we think we ovulated, 75 to 85% of the time, we were right within a day in either direction. So that's pretty good. 75 to 85% of the time, we're accurate within a day by simply tracking our cervical fluid. This does not include temperatures. The Creighton method and the Billings method are cervical fluid only. So just by cervical fluid, we're most of the time, we're within a day of accuracy to when actual ovulation happens. Both studies showed that 100% of the time, we were within 3 days. So that's pretty great statistics for showing the accuracy of our own tracking of cervical fluid. So this brings me on this topic of contraception to discuss effectiveness. And I'm starting, I hate to leave this slide on for long, I'm starting with the CDC's slide, which shows fertility awareness-based methods to be way down here at least effective with a whopping 24% failure rate. So the reason I share this slide is to point out the inaccuracy, or basically to point out the way that this study went about getting this information and why we don't want to rely on it for our understanding of the practice. So it says FABM, right? So this is a conglomeration of all cycle tracking methods. This includes the rhythm method, cycle beads, just apps, and symptothermal methods. This is also based on, it's called a retrospective, I forgot the other word, but basically how they get this information is they call women and they say, hey, what form of contraception did you use this last year? And did it work? So they say, oh, I used fertility awareness. Did it work? Did you get pregnant? Yes, I got pregnant. Okay, thank you. Click. That's the information they use. So this also includes any practice similar to what I teach. But it also includes taking risks and making mistakes. So that's why it doesn't get very good statistics, right? And why we continue to therefore have the misconceptions we do in our culture, in our healthcare system about the effectiveness. If you go to your medical doctor, or probably most Planned Parenthoods or clinics, they will say, oh my God, that does not work at all. This is where they're getting their information. So I want to show you an alternative to that, which is what do you call that? Not collaboration, conglomeration, I guess. No, there's a word. This is bringing together all these different methods here and giving you specific statistics for each method alone. FACS is responsible for this wonderful table. They only used sort level 1 studies, which means that they're high-level studies. They had to have certain criteria met to be included in this. And then this is the citation of which study was used. So we can see correct use. That's perfect use. That means if you use the method just as it was taught, how effective is it? Versus typical use. That includes you took a risk, you made a mistake, something like that. So Billings and Creighton are cervical fluid only methods. And here's the studies and statistics that they have for failure rates. The 2-day method I mentioned is simplified cervical fluid only method. Not so great. Marquette was the method that includes a device. And standard days method, that's the upscaled rhythm method, up-leveled rhythm method. Lactation amenorrhea method, that's the postpartum method. And then the one I skipped over right here, symptothermal method. This is the German study, the Petra Frank Herrmann study that I mentioned, which has an extremely low failure rate using in the correct use. And even in typical use. So even when people did make mistakes, the ratings were very, very good for typical use. Now, given this is a culture which we could stereotype. If we were going to stereotype a German culture, also run by a medical school, there is a possibility that this study was comprised mostly of quite responsible, together people, educated and well taught, which isn't necessarily representative of a greater diversity of population. There are some other drawbacks or downsides to this study. Nonetheless, and I'm not going to go into this now, but nonetheless, these are really great statistics to work with. So here is an image that one of my graduates made that includes fertility awareness-based methods, just a few to make it a little more simple, and the perfect use and typical use. This is success rates, not failure rates. And then comparing it to hormonal birth control and barrier methods so that you have a sense of how it compares. And also, for instance, if you use the withdrawal, what statistics are you working with here? Or a male condom, 98%, withdrawal 96%. The method that I teach, 99.4 to 99.6, if I include the rule that the German practice used, which is the calculation rule, which I do include when I teach the practice as an option. So I really appreciate this handout to give us even better sense of accurate results here. Okay, so we're going to move on to fertility awareness and conception. Another brilliant reason to utilize this method is if you want to conceive and do it with a sense of consciousness or purpose or intention. Of course, a lot of people get pregnant easily just by being in the, as I call it to my young son, the love field. And we all have the option to invite a pregnancy in. And then there's those who perhaps need a little support. Their conception isn't coming easily. So I'm going to discuss those things here. These are some of the benefits that the practice offers in this situation. Optimal intercourse timing. That one's pretty obvious. When you're fertile, you know you're fertile, you have intercourse then. Key markers of fertility. So assessing a chart and seeing if you have what it takes. If you have signs of optimal fertility. Identifying, on that note, identifying hormonal imbalances and other health issues is something that can be found and seen on charts, and so we can act preventatively to optimize fertility. And then targeted hormone evaluation means getting your tests, your lab tests. This is more for somebody who's having challenges. Getting those lab tests done on the accurate day, on the appropriate day of your cycle. Modern medicine doesn't necessarily understand that. So if you want to find out your progesterone level, you don't want to take it before you've ovulated because you shouldn't have progesterone then. You should take it in your luteal phase after ovulation. If your cycle is not regular, that timing might be different than what your doctor might say, take it on day 21, but maybe you don't ovulate till after that. So there's a lot to be said for the timing of those labs. And then if you're working in a healthcare position, understanding the client's self-care capacity. And lastly, when we do this practice, we learn about our uterine positioning if we do cervix checks. And a lot can be discovered and changed by working with uterine positioning, especially regarding fertility. So to break down a few of these things, key markers of fertility, what I'm looking for on somebody's chart to know about their fertility is that they have good quality cervical fluid, that I can confirm they ovulated, and that they have a strong luteal phase. You've heard me use that term a lot now. That is the time from ovulation until your next period, and it shows us the strength of the progesterone in your system. And the strength of progesterone in your system is what helps you to stay pregnant, to keep a pregnancy. It's when implantation happens, and it's when you create the terrain for a pregnancy. So we study the two phases, the fertile phase, the estrogen phase, the follicular phase, and the progesterone phase, and assess the health of your hormones from what's happening in those phases. In regards to prenatal and postpartum care, this lists the items that can be super helpful in various ways. First of all, accurate due dates. Many women are in the position when they get to their due date that it was based on an assumption of average length cycles rather than the cycle in which they had when they conceived. So this can make a difference in your care when you're giving birth. And then basically preventative care to optimize your outcomes. So noticing a luteal phase deficiency and working with that beforehand, or noting it for what it might create during the pregnancy. You can also potentially see signs of an impending miscarriage on the chart. And then lastly, using non-hormonal contraception postpartum is quite a wonderful offering. Conception while breastfeeding, I'm not going to go into right now, but to mention that this practice itself is a wonderful option. It's best, it's optimal when you learn it before you get pregnant, and so you already have an understanding during the breastfeeding time, but it is possible to learn the practice during the breastfeeding time and to implement it as you're ready to become sexually active again, and then as your cycles are returning. So I teach about ecological breastfeeding, which is a parenting style that slows the return of your fertility. And I teach about using fertility awareness during the various phases and educating yourself on the phases of those postpartum months. A little bit more on that. My recommendations are understanding lactation amenorrhea method, but utilizing the fertility awareness method. Teaching ecological breastfeeding and teaching the phases of the breastfeeding transition. So when a client has fertility challenges, or if a woman has fertility challenges, there are numerous ways in which this practice can be implemented. Many I've already mentioned, but also in preventing unnecessary interventions, basically looking to the root causes of whatever's going on before stepping into the world of reproductive technology. And this inevitably will uphold the wisdom of the woman. And that is what I would seek to do, and particularly in a situation when you move towards reproductive endocrinology and specialists to support a woman with this type of empowerment and connection can be very valuable for a positive outcome. So moving on from conception, this next slide is sharing, or these next slides are sharing a bit about how we might use this practice to assess or understand our cycle health. There's a term that's been used a lot in the last many years called psychohealth as the fifth vital sign. And the concept is that we have these vital signs, these things that we check, our blood pressure and our heart rate and our respirations, that are signs about how's our body doing. They can speak to a lot of different functions. A lot of more intricate imbalances can be seen through our vital signs. And so this concept is that when we track our cycle health, because our cycle health is downstream of so many other aspects of our health, that when we track it and we see what it tells us, it informs us about deeper set issues. So when we track what I list here, our signs of fertility, primary and secondary, the emotional changes and patterns, our lifestyle choices, the progression of symptoms, pain level, medications and supplements and diet. Combine that with this information that just what's happening in our cycle gives us. And I believe we have an incredibly strong tool basket for preventative holistic healthcare in the world of functional medicine, where we're looking for root causes and looking to address root causes of illness or imbalance. This is a fantastic option. And I think that's becoming more and more known, and there's a long ways to go. But our reproductive energy is like extra energy. It's not where with the amount of life force we have. That life force is first going to be directed towards primary functions, and only secondary if we have enough to keep our heart beating and our blood circulating and our guts digesting. We have enough, we will also have healthy cycles. And I teach about this in another course, about how those building blocks for making the sex hormones and the cycle hormones are borrowed and utilized for a lot of other processes in the body, especially to make cortisol, to deal with stress of any kind. So that also goes to show that when there's interruptions or interferences, our reproductive system will lose out. So that's a little bit more about why this term has come along and what can be gathered. So as a healthcare practitioner, this list represents some of the things, not all of them, that we might be able to see, to identify on a chart. And therefore be able to work with more consciously, more readily. Some of these would be a combination of our chart and our intake, or our health history and health signs. So besides contraception, conception, breastfeeding, postpartum that I've already mentioned, this is a list of other transitions in our life in which we will have a one-up if we're in this communication with our bodies. If we have engaged this intimacy with our bodies and our cycles. So from the beginning, menarche, and establishing our rhythm, to the end of our reproductive years in perimenopause and the menopausal transition, throughout several other moments in time that you as an individual may or may not experience. So we're almost done. What I'm going to do now is show you a few charts, and this is to really land it within you what it looks like to chart your cycle. So this is obviously a paper handwritten chart, and I'm not going to go deeply into it, but there's some details, dates and days of the week and moon cycles and such. But what I want to point out is Here is the cervical fluid observations or secretion observations here that we're tracking. Putting those into codes. If you learn the practice, you learn how to code things to make it really clear when you're in your fertile wave. So the wave code, this is the point of change. That's the beginning of your fertile wave. The peak day is the last you see of your fertile fluids, and your post-peak count. So this column shows you where your fertile time is in a given cycle. And that's informed by this and this. This is your sort of your secretion observations, and this is the secretion codes. And then over here, and this is the cervix, which you would learn about if you learn to do the cycle tracking practice. And this is the temperatures. So each day you take your basal temperature and you circle the appropriate circle. So 97.4, 97.1, 97.2. And you can see very clearly that there are two ranges of temperatures. This being pre-ovulation, this being post-ovulation. The progesterone that's present after we ovulate is what raises our temperature here. And the estrogen during our fertile time is what keeps it low, right here. So, so that just gives you a sense of what a chart might look like. And I'm going to show you a few more before we finish for today. This is a pregnancy chart. You can see those little pluses. That's the column for pregnancy test. You can see the low range, the high range, and you can see how the temperatures continue to remain high after a normal length of a luteal phase. The temperatures remained high, which is an indication that a pregnancy has occurred. This is an anovulatory chart. So both of those last cycles had a low range and a high range. This does not have that. The temperatures are bouncing all about, and they do not reach a high and sustain in a high range. There's some high temps here and there, but nothing sustained. So this is a representative of an anovulatory, non-ovulatory chart. And this is a teaching chart from Kindara to show you an image of an app. Kindara is an app that gives you the option to have predictive feature or not. So they will let you make your own decisions about if you're fertile or not, or you can set it to predict. I recommend that you learn the practice, and so you don't need to set it to predict because you know on a daily basis if you're fertile or not. But this shows the different types of cervical fluid and how you chart them with these bars. You put the information in and then the bars show up like this. And then it marks the peak day, which is the last day of the superfertile fluid, watery or egg white, superfertile. And then it marks your post-peak count and continues to mark the luteal phase count or your high temps. This also is representative of a short luteal phase and an extended fertile wave. So this is an example of a hormonal imbalance. The fertile wave is overly long or excessive, and the luteal phase is short. This is a common imbalance that that women experience. And I'm going to skip that chart and talk about, I'll just tell you what this is. This is a story, the beginning of a story of someone who has a thyroid condition. And she has many temperatures that are down here, basically in the 96s, in the very low 97s. This combined with a lot of other information that her chart gave us, including often short luteal phases, and symptoms that she was experiencing led us to believe she had a low functioning thyroid and led her to get the test she needed and the treatment that she needed. So, in closing this class, I want to mention the current and future climate of fertility awareness educators. This is the signature from our professional organization, the Association of Fertility Awareness Professionals. You can look that up online. And we are a professional body, international professional body, that is creating a standard of care around fertility awareness, cycle tracking practices, and a certification process. Currently, those who are certified through AFAP have had to go through one of 3 training programs internationally. My training program, the one in Canada called Justice, and one in Israel called Poriutivit. We will, in the coming years, also be certifying educators through other manners, including an in-house certification procedure or process, but currently that's where we're at. And I feel that this is really, really a helpful evolution of how we hold this practice, these practices professionally, and bringing them into the mainstream, and bringing them to the forefront as effective, valid, and important practices. I also mentioned to you FACS, which is organization teaching in medical schools, that is a great resource. And NAPRO Technology is a book written by a doctor who has initiated a program that's been around for quite some time of training doctors to include the Creighton method of cycle tracking in their healthcare practice. So before they are doing labs or procedures, they're assessing charts. So they've integrated the fertility awareness or body literacy practices into a medical care system, which I think is brilliant and a sign of the future. I think I've discussed this concept enough, but I will reiterate that there are a lot of risks in DIY, do-it-yourself fertility awareness, especially when the education is missing and you're relying on a device, you're relying on technology rather than your own body. I don't believe that's where we want to go in our culture. Some people would disagree with me. I have just had too many benefits over the many, many years that I've charted. I've been tracking my cycle for over 25 years. So the innumerable benefits that I've experienced would not happen if I were looking outward to an app to tell me what was going on. So I will continue to teach the way I do and recommend that if you use an app, you use it for data entry, but you get your education outside of that. And then I have a little Facebook sign because another very common thing that's happening is online groups discussing our charts. I think it's wonderful, and there's a lot of risk there as well. Having dedicated a good share of my life to women's health and to understanding and interpreting and working with these practices, it's hard for me to watch the misinformation that is abundant on these sites. Now, there's also a lot of helpful information and accurate information. So both are true. But I say be careful, be wary. Sure, join a group, but be careful. And again, it's bringing awareness to this practice. I just think we need to also, it needs to retain the quality of ancient wisdom available to every woman, should be available to every woman. The accessibility, the like really just basicness of it, and at the same time meeting the current culture that we're in, which includes science and studies, and will be best served by having evidence-based statistics to bring this forth into the mainstream as well. So how do we hold all of that? The study I'm in myself. So here's a couple of resources that I mentioned during the slideshow. And a couple of images here to close. My belief about what's possible and what I want for those that I work with. It's a deeper understanding. And this is just funny. Where we're moving towards, perhaps, where we could move towards, perhaps, in that model of care that I mentioned. So, I'm going to say a few closing things here before we're done. Thank you. Thanks for your time and your presence in receiving this information. And I want to close by sharing my understanding of how the life force moves through us and the overlay between this practice and our sexuality. It's inevitable when in discussions or in the personal exploration of this material that we confront our sexuality, because we're talking about having sex, we're talking about intimacy. And I encourage each of us to take any opportunity as we learn about this material, to take any opportunity that arises to explore and examine our relationship to our sexuality. Because I think that that too is at the forefront of the cultural change that we are within, in becoming more sovereign in the way we relate to our sexuality, and in recognizing that the way the life force moves through us, the way we experience both sexuality and sensuality, is vital to our health, and it is representative of what we're here to do in the world. That's how life moves through us. That's the spark of creativity that we each carry, that is absolutely individual and authentic to only us. And so as we learn about it, cultivate it, experience it more fully, I believe it's bound to have profound results in our life path, in our happiness, and our ability to show up in this world fully awake, enlivened, and potentially bring us great joy. So it's an honor to me to work within these realms and get to support that growth in as many ways as I can. So again, thank you for showing up, and I hope you enjoyed the talk today. Bye-bye.